My name is Brandon Lewis. As Ashley said, I'm the medical director for the Emergency Services Department here at St. Joseph Regional. And I was asked just to say a couple of words about the processes that are put in place to help victims of significant trauma, like you're all here to hear about today. Just to recognize some of the folks and the teams that combined that led to the great outcome we've had here. As many of you know, St. Joseph Regional has long been the lead trauma center in our area, but about 12 months ago, a decision was made, a need identified for a higher level of trauma care. And at that time, we began the process of going to a level 2 trauma designation, which meant that we really had to bring a lot more resources to bear for our trauma patients in this region. That included working cooperatively with all of our pre-hospital providers. We've started a lot of collaborative work with the Bryan Fire Department, Robertson County EMS, St. Joseph EMS, working with College Station providers as well. That also included new resources, the hiring of 4 dedicated trauma nurses, also the region's first fellowship-trained critical care trauma surgeon that joined us here at St. Joseph a few months ago. Also, training and with the emergency department to improve our trauma processes. We have a large number, actually, of former military emergency physicians, several of whom, including the physician that took care of Ms. Holdsworth with combat experience overseas. So, when something bad happens, we would rather it not happen, but we like to have the resources and the processes in place to take care of anybody who might need our services. In this case, really the processes worked exactly the way that we had hoped they would. The excellent care provided by the pre-hospital folks. You had cooperative efforts, again, between the Bryan Fire Department, the College Station Fire Department, St. Joe's EMS. You had a trauma team on arrival waiting when our patient arrived. Multiple emergency physicians, trauma surgeons at the bedside, and OR crew waiting, emergency life-saving procedures performed, and then immediately to the operating room. And that's exactly why we've made the efforts that we have. And it just goes to show all of those in the region, both at the hospital and the pre-hospital side, why we've undertaken all the work that we have in the last 12 months. And if for no other reason, this one patient made a huge difference. So thank you to all of you, both the pre-hospital folks, the trauma team, emergency department staff, ICU staff, who have had such an impact, not only for this patient, but for many in the future as well. Do we want to have Dr. Carlisle talk to you?
Speaking next is Dr. Adair DeBerry Carlisle, and she was the Trauma Services Medical Director.
Can you start by spelling your name, please?
How much time do you have? Yes, ADAIR DEBERRY CARLISLE, and that's not all of it. No, my monogram looks like an eye chart. They asked me to come speak to you guys. There's been all kinds of stories, as is so typically the case, of what's going on. They wanted me to kind of update everyone on Barbara's condition and her care and what's been going on since she got here. When Barbara was brought to our emergency department by, I have to say, an outstanding pre-hospital group of guys, she was unstable, bleeding, and in extreme danger. We got her here, got her on the table. We had to put tubes in both sides of her chest. Both of her lungs were collapsed. She had 2 gunshot wounds, and she needed a tremendous amount of blood, and she was also intubated in the emergency room. She was immediately taken to the operating room. What's important to understand about that is that all of that took place in 27 minutes, and she was on the table in 27 minutes. Cardiothoracic surgery came in with me. We were the 2 primary surgeons, and that's Dr. Charles Smith. He was right there, Johnny on the spot, in the emergency room prior to heading over. The nice thing is as soon as we got her in the operating room, her blood pressure stabilized. And fortunately, we were able to take some x-rays and kind of get a little bit better idea of what we were dealing with. Now, this is what is interesting. What we found was really kind of wonderful. She had had 2 gunshot wounds, one to the left chest. The bullet entered her left chest, split in half, and went on either side of her heart, and it did not damage her heart. The other bullet entered her right shoulder and exited her left shoulder, crossed her back, broke multiple bones along her spine, multiple ribs, and did not violate her spinal cord. So she is amazingly blessed and just really very, very fortunate. She has been in the ICU ever since surgery. We did actually, at the time of surgery, open up the sac around her heart, make sure there was no damage, no injury, so everything was absolutely good to go as far as that's concerned. We got her up into the unit. She's been in the unit since she's been here. She is now off the ventilator. She is talking, alert, sitting up in bed. In fact, I was just up there. She made a loop around the entire length of the ICU walking. And apparently yesterday, and I don't know, they say there's so many different doctors that contribute to this success, but apparently Dr. Pepper helps. She did have a little bit of that yesterday. Now, in all seriousness, we look at Barbara's case with cautious optimism. She is doing very well. This is day to day, and we are addressing still some injuries, still some issues. We are very pleased with her progress. And please, folks, it's important to understand when I say we, this is a trauma team. This is a group of very dedicated, extremely talented individuals who are 100% committed to what we do. We're here to help the people in this community and help them when they're injured and when they need us. It's what we do, and it's our passion. We are very fortunate to be able to do it. Thank you.
Next, I'd like to introduce Andrea Jones, and she's a family friend of the Holdsworth.
I believe I am the last one. The family has asked me to be the spokesperson. I'm one of Barbara's closest friends. But before I say anything, the family really wants you all to know that we consider this nothing short of a miracle. And we praise our Heavenly Father for the protection and the healing that He has provided for Barbara. As redundant as this may sound, we feel that it's extremely important that you all recognize that we thank the Bryan Fire and Police Departments, the College Station Fire and Police Departments, the University Police Department, the Brazos County Sheriff's Office, the Brazos County Constables, the Texas Rangers, the entire and incredible St. Joseph Hospital team, Texas A&M, and this remarkable community. Dr. Kyle stole a little of my glory. I was going to talk about some sort of the personal things that we've experienced with Barbara since Monday, and it has been remarkable every day, really, with the little baby steps that she's taking. And one of the ones that brought such joy to us was that indeed, when the nurse came in, when she finally got the breathing tube out, and they said, how are you doing? She said, I'm so thirsty. And the nurse said, well, we'll bring you some ice chips. And Barbara said, oh, I gotta have a Dr. Pepper. And that to us brought us such joy because we tried to tell Dr. Carlisle all along that really that was the medicine that Barbara really needed. Throughout this ordeal, we have experienced some joy. I think we've experienced joy in each other, joy in the friendships and the relationships that we share. As a family, it's been really tough on her friends, but we've done this together, and it is nothing short of the most incredible sight of praying people you have ever seen. I said that if this had happened to anyone else I know, it would have looked like a Mexican soap opera upstairs, and instead it just looks like a group of faithful people who are here to support and get Barbara through this. We did get some added joy yesterday. Barbara's son, when the Texas A&M coaching center go and tour the A&M football facilities, and much to my personal dismay, as He has been a lifelong Longhorn fan